Colon cancer screening is very important because colon cancer is one of the most common causes of cancer mortality and is one of the most common cancers in the United States. There's about a 5 to 6% lifetime risk of getting colon cancer by the average person in the United States. So it's a very important disease to look for, to screen, because it's ultimately detectable at its early stages, preventable if caught before it becomes a cancer, and ultimately curable if found early. But unfortunately, it's ultimately deadly if found in a later stage. Well, colonoscopy is an invasive procedure, and like all invasive procedures, it has its potential risks. The major complications that we see with colonoscopy is about a 1 in 1,000 chance of perforation or poking a hole through something. There's also a chance of bleeding, especially if we remove lesions, and that is on about 1 in 500 risk. Procedural failure can occur, although in expert hands that's a very low rate and very low risk of procedural failure. And certainly because we do use sedation and medications to keep the patients comfortable, medication reactions can occur, but again, that also is very uncommon. Overall, it's a very safe procedure. Colonoscopy is a very well-tolerated procedure. There are those horror stories that patients will spread amongst themselves about the discomfort that they had, but in expert hands, colonoscopy is a very comfortable procedure. Patients are typically sedated, and so they usually don't experience anything during the examination. Afterwards, there can be some gaseous distension and bloating, but at Kootenai, we use carbon dioxide during our examinations, and that is rapidly absorbed and thus limits the amount of discomfort and gas and bloating afterwards. And usually the most common thing I'm asked in recovery area is that it? Are we done? And yep, that's it. And that was a colonoscopy, and so their fears going in are much greater than expected. So overall, it's a comfortable and well-tolerated procedure. At Kootenai Clinic, we have board-certified gastroenterologists who are recognized experts in gastrointestinal diseases as well as in endoscopic examinations. We also have a very state-of-the-art facility using high-definition video equipment, computerized records and digital photography, carbon dioxide insufflation to keep our patients comfortable, as well as propofol-based sedation by our anesthesiology colleagues to keep them safe and comfortable during their examinations. We also are quality focused at Kootenai. We follow the national guidelines for monitoring precancerous polyp, or what are known as adenomas, our detection rates on those. And I'm proud to say that we're well above national standards for those detection rates, offering quality services here at Kootenai. When it comes to colon cancer, get screened. And even though colonoscopy is the preferred method for getting screened, as I always say, the best test is the one the patient will actually do. So it's important to get screened, and if you do go for colonoscopy, to ensure that you have your procedure done by an expert endoscopist, by a board-certified gastroenterologist who understands the disease as well as the endoscopy procedures.